Welcome to the Inspired Children Parenting Program with Dr Rosina McAlpine, making a difference to parents and children around the world. Hello and welcome back to another episode of the Inspired Children Parenting Show. I'm here in a busy location in Chatswood at the Pro View Optical. Why, you might ask? Well, a few weeks ago, I was walking down the street in Chatswood, Sydney, Australia, where I'm from, and I noticed that there was a mother and a child talking. The little boy said to his mum, "Mum, my eyes are hurting," as he was squinting, and said, "I really want some sunglasses." And his mother said, "Children don't need sunglasses." And that prompted me to think, is that true? I looked around and I noticed so many more adults with sunglasses than children. So I decided to walk up to my favourite optometrist and come up here and talk to Dr Katrina Chim, who's the optometrist here at Pro View Optical in Chatswood, to ask her the important questions that you might be asking yourself too. How to keep your children's eyes healthy. I'd just like to welcome Dr Katrina to the show.
Hi, Dr Rosina.
Hi, Dr Katrina. I really appreciate you doing all this research and taking the time to do this, because I think so many parents don't really know if it is important. I mean, I just wanted to ask the question, do children need sunglasses? Is that true?
Short answer, yes they do. They need it just as much as adults do, possibly even more so.
Why is that?
Well, the whole point of needing the sunglasses is because of the UV exposure there, and you know, some studies have found that exactly children are a bit more susceptible to UV damage than adults might be there.
A lot of people have heard about UV damage in relationship to their skin and skin cancers. That's pretty well known, and we have our slip, slop, slap and slide on the sunglasses.
That's it.
But can you tell me a little bit, for those people and myself, exactly what UV is?
Okay, so well, firstly, UV is ultraviolet radiation. It's a component of solar radiation from the sun there. You can't see it, and the human skin actually can't feel it there, but it does cause the damages as well. We all know the skin damages from UV, you know, with the wrinkles, sunburns and skin cancers in worst case, but it can also affect the eye there as well.
Oh, in what way does it affect the eye?
So there's a number of ways it can affect the eyes. You've got either short-term kind of effects or long-term ones. Short terms might be a lot of a bit of irritation or eye pain, excessive blinking, sensitivity to the light, and in some very high bursts of UV exposure, you can get what we call photokeratitis, which is like a sunburn of the eye. It's quite painful. You can even get temporary vision loss for up to 24 to 48 hours there.
That sounds really serious.
That's it.
I noticed that I've actually noticed when I've been down the street and watching mothers push prams that children tend to have, like babies particularly, tend to have a reflex action. You know, you'll be walking in the shade and then they might move into the sunlight and they just, you know, shut their eyes. And I've noticed that, well actually I haven't noticed hardly any babies, like any babies with sunglasses. Is it important to start from babies?
It's absolutely important to start from baby's age, because with UV damage, it's cumulative over the years. So any exposure always adds up, and it builds up and it increases your risk of UV damage there. So it's never too early to start, basically, to be able to protect your babies and your children's eyes from UV damage.
I remember when our son Cameron was young, I had heard something along those lines, but I haven't had this in-depth knowledge, so thank you for that. But that babies needed sunglasses, and so I remember we used to spend a lot of time outdoors because it's just healthy for babies to be outdoors, you know. Yes. So I used to have him in my carrier, and what I would do is I'd put on a little hat for him, I'd put on my hat, I'd slip on my shades, and I had some sunglasses, some shades actually for him. And I know a lot of people looked at us and kind of smiled and thought we looked a little bit, you know, cute or funny. But it's more than that, isn't it? It's more than just a good look, right?
Correct. It's like you said, it's absolutely vital, and you nailed it on the head. I mean, sunglasses are so important, but it's about the whole protection there. You know, staying in the shade, wearing a broad-brimmed hat to be able to protect it. That reduces your UV exposure almost by up to half by having that hat alone. The sunglasses on top, you know, really builds up that protection there. So it's not a silly look. It's only being protective there. You can never start too early, like I said.
Excellent. And with babies, obviously, they're not going to keep them on too easily. What do you recommend
No,
with
so
babies?
what we recommend with babies and, obviously for very young children is actually a pair of sunglasses that would have an elastic strap over the back there, so that way you can keep it securely on. If they're fiddling about, they're not going to kick it off. It's not going to fall off there as well. The only thing, obviously, with those types is, again, making sure that the elastic strap and the arms themselves are quite securely on, so that they themselves are not a hazard, to your child there.
Oh, that makes sense.
Absolutely.
Now, I remember I was able to put them onto Cameron and he had no reaction. Like, he was just quite happy with them. So where can you, I remember I actually did get it from an optometrist, I remember that, so I came. But where else, is that the best place to get these items?
That would be the best place because we can be sure that those sunglasses will meet Australian standards for UV protection, because toy stores and so they might sell like sunglass looking type, but there's no way of ensuring that they meet the standard for UV protection, and that's what it is all about at the end of the day there.
Awesome. I love that you've said standard for UV protection, because you can get sunglasses at the $2 shop,
Correct.
right?
Yes, yeah.
So that's not highly recommended, right?
No, it's not. Like, look, it may or may not be able to reach the standard, but there's no, I guess, sort of monitoring and policing like it is when it's purchased either, from the optometrist or other places like, say, like the Cancer Council shops there. Yeah, they offer a good range too.
I know that with Cameron, when I bought those sunglasses, they lasted for a long time. He had them for quite a long time, and they were adjustable, and I could adjust it, and he had them for a long time. So even though I had the expense, it lasted a long time.
That's it, exactly. And the main thing also is that it's not just a summertime use. You wear it all year round, because yes, we know, we feel the heat and so of the summertime, but UV is present all year round too. So you're going to have so much use out of it. It's still advisable to have that sunglass protection overcast days, cloudy days, because UV is still present there.
See, these are all such good tips. And so when you move from babies to toddlers,
yes,
what are you looking for, or even older children, what are you looking for in sunglasses to make sure that they are going to give your children the right protection?
Yeah. So again, like I said, one is purchasing from a reputable place to make sure that it meets the standards for UV protection there. And the next most important part is that it's obviously a well-fitted one. The best sort of tips for both, babies, children, even for adults really, is that it's something that's a little bit more wraparound, so that you get the side protection from, say, scattered light that might be off, scattered light off the clouds or off shiny surfaces, like if you're at the beach or at the snow. And then you want it fitting as close to your eye as possible, again, so that you're not getting sort of the stray light coming from above or below there as well. As close as possible without touching the lashes. That's when it gets annoying.
That's awesome. I'm going to just do a quick recap. So if you can listen to me and make sure I haven't missed anything out before we actually try doing a fitting with our son. So first thing is that sunglasses are really important for children right from babies, right from day one. They can be worn all year round because UV is present all year round. They should be glasses of meeting the standard, the minimum standard for effectiveness, to make sure that the UV rays are actually there. And sunglasses on their own are not as good as a broad brim hat, and at sometimes taking children into the shade so that they're not in direct sunlight.
Combination.
Yeah, great. They should be fitted by an optometrist so they fit correctly, or a reputable organisation like the Cancer Council. Have I forgotten anything?
No, I think for a video that will be fine. Like you said,
perfect. So now, the only thing that I'd really like to do is to give you a demonstration. So Dr. Katrina is going to demonstrate on our beautiful son Cameron. Do you mind coming up here and being a model, Cameron? Okay. So Dr. Katrina is going to put some sunglasses on you and explain how it works.
So for Cameron, we've got this dashing pair, and if we put those on, so we can see, we'll turn around Cameron there a bit. So we've got a good wraparound style here, and it's sitting nice and close to his eyes. You know, there's not too much gap at the top or the bottom, so again, maximum protection from those stray rays. That wraparound style, again, from the stray rays that might come from the side there. Again, it's fitting quite nicely behind his ears. So Cameron, if you tip your head, yeah, that's it. And if you tip your head down slightly, just tip your chin down a bit. That's it. We're not seeing too much movement of the sunglasses. So again, he's running around, and so it's still going to stay on. And then once again, the main thing is that the lenses in themselves meet those standards there. You can see it's marked, it's got 100% protection from UVA and UVB rays there.
Oh, excellent. So, Cameron, does that feel comfortable? Now have a look in the mirror. How does it look? What do you think? Do you look cool? Okay. So not only is Cameron getting good eye protection right now, he actually looks very cool. Thanks, Cameron. Do you want to go and sit down so I can finish off with Dr. Katrina? You want to pass those back to Dr. Katrina?
Thank you, Cameron.
Thank you so much.
Thank you.
I think we'll have to take those home with us.
That was a really good fit.
They're a really good fit.
Yeah, they really were. I was like,
So, I guess if you could just sum up by saying, what are the sorts of things we're preventing happening over the course of life of our children, so that we can, when Cameron is, 80 or 90, he's not going to have problems. Tell me what we're preventing by.
So the long term, what we're by, like I said, just having that constant wear of the sunglasses, whether it's summer or winter. The aim is to prevent it from other UV-related eye diseases or conditions. Namely, cataract formation has been quite linked or accelerated by a lot of UV exposure in your lifetime, and macular degeneration. So macular degeneration, one of the biggest causes of blindness.
One, right?
That's the big one there, yeah. One of the biggest causes of blindness in people who are over 60, and treatment is often quite difficult if you don't get onto it early there. So that is also being linked to UV exposure.
Excellent. And the final thing is, okay, so cost. I know that sometimes it's a little bit difficult to afford these things, but if we're talking about a lifetime of your child's eyes, what can we expect to pay for a good pair that meets the standard? What's the sort of range for sunglasses that you could pay?
You'd be looking, I think, maybe starting from about $40, $50,
yep.
And then it can go right up to up to maybe like about 150 or so. Really just depends what you would like there. Part of it, to that point, though they will all meet the standard, just becomes a bit of a brand or a style sort of thing there. So just what you want. But again, it's just making sure it comes from a reputable place that meets the standard.
I have loved this interview. I feel so much more informed, and I know that now it's much more than just it's just much more than a fashion accessory. I know some kids love to have their sunglasses on, but now let's make sure we're not just buying toy sunglasses. Let's make sure that we're buying sunglasses so we're protecting our children's eyes for life. I really, really appreciate it. Thanks, Dr. Katrina. Thanks for your Rosina. See you next time on the Inspired Children Parenting Show, where we'll have much more information, as we always do, about helping you help raise your kids. Thank you. Bye for now.